When Ian asked me to speak at this meeting, I'm delighted to be here. He said he wanted me to talk about functional capacity. Functional capacity. So I am going to talk about that, but put it in the context. What is it? What is it? It's an issue for aging workers. There's a few aging workers in here, and I'm the oldest probably. And it's really quite important because it's one of the causes of, if you like, disability. It's one of the things that's declining, and where good employers will make reasonable adjustments so that people can continue to work longer than they would otherwise do and don't have to prematurely leave the workplace. So that's it. But I'm going to put it in. I'm going to talk about quite a lot of. I'm going to go very quickly and happy to answer any questions. So first of all, population. This is demographics of where we're at since 1901. The bottom left, this is the age profile. So in 1900, it was very much a pyramid. Not many people reached a very old age. In the bottom right-hand side, you can see that there's relatively few young people and a lot of older people. So we're an aging population, aging workforce. And that's why functional capacity is quite important. And there's epidemiologists, that bottom chart on the right-hand side, call us the coffin generation, because it's the shape of a coffin. And the problem is 50% of the world lives with chronic disease. And over the age of about 50, in this country, over the age of 50, half the workforce fall out of work between 50 and 64. And the commonest cause is because they've got health issues. But over the age of 50, you start developing health issues. You know, two or three health issues when you're in your 60s. It's not common. And when as we age, we gather more health issues. When you get about 9 or 10, we die. So, but in terms of working lives, it's an important issue. Now, the original definition of health was about complete physical, mental, and social well-being. I've never actually met anyone yet in that state, and that definition is really not appropriate. And we developed, I and Ian Doherty from down in Lanarkshire, coined the term healthy working lives as the definition for health. And that's about being able to do as much as possible for as long as possible in your working and non-working lives, or as much as you want to do. And that's generally what I think. So health is really, to me, health is really about the level of functioning. Generally, when I get referrals to me, it's really about what people can do. So I'm assessing functioning and how jobs can be modified. So this is the picture of the number of people in employment in the UK. And you can see 80% of the population are in employment. And you can see that at 50, the top line, at 50, it drops pretty fast. This is the business of people falling out of work. Now, it may be because someone's given the enormous package, or they've decided to leave for another reason, or they've been made redundant, or they've been sacked. And so a lot of people fall out of work over the age of 50. And they're particularly vulnerable group to job loss. And why did they fall out of work? Well, this chart shows you, if you look at the slide along the bottom, and you can see what age you are, and you can see your risk of developing various diseases. And I don't want any of you to get depressed as a result of this presentation. So, and if you do, very happy to tell you. And you see, the older you get, the more conditions you have. And that's just a fact of life. And if you put that second slide over the first slide, which is very bad academically, but you can see why. It's a number of medical conditions is the biggest factor why people will lose their jobs as they age over 50. So it's really an important issue, functional capacity as you age. Another way of looking at functional capacity is maintaining your fitness to do tasks. And this is a slide as well, reasons for not looking out for work. People who are inactive but are willing, but reasons for not looking at work. And these are the reasons at the bottom. Looking after home and family is one of the ones. Having an injury or a health problem is the main one, and other. So my job in life is not to keep people working till they're 90 and force them to work till they die. But when I get referrals, I find when I introduce what I do, because most people don't understand occupational health and are suspicious of it because of the bad stories, I'll say to them, my job in life is to keep you working till you're 95, and they always laugh and relax. And it is, in a way, that's it. You know? But it's not compulsory. Yeah. But with the declining birth rate, which is really falling very rapidly in the UK and across the whole world actually, people are having to work longer, and we've seen the retirement age go further out. So the other thing about work, when I trained in occupational medicine in the mining industry 50 years ago, I looked after ended up looking after the Yorkshire coalfield for the last 10 years, the Yorkshire coalfield. It was a very big service. I personally, in my 10 years in the coal mining industry, and I was one of 8 doctors looking after Yorkshire, I personally dealt with 30 fatalities underground. And very few people will experience fatalities, hopefully, in their jobs. And so nowadays work is, and it's important to realise that while we're talking about hazards of work, actually you're generally better off, live longer if you are in work than if you're not in work. And unemployment is bad for people because there's loss of income, you lose a purpose, risk of ill health goes up, and you get scarred, psychosocial scar persists, and it even affects the next generation. And this is a wee bit of health here. The common mechanism for disease is inflammation, actually. Not just the inflammation you get in a scratch in your hand, but inflammation in the system. And you can measure inflammatory markers in the blood. And this is a common pathway for development of disease. And this was a study, there's got a lot of other studies like this. It was a study of 5,000 men and women in Finland who were unemployed. The men unemployed over 500 days. And you've heard of DNA? Well, DNA chains are in your cells, and as your cells are replacing themselves all the time, these chains shorten. So a wee bit comes off the end. And when you get really old, the chains have got nothing left, and that's when you see some wee wrinkled person you don't recognise who's just waiting to die. And there's not much we can do about that. But this is an effect on men. Women as usual, get away with it. No effects on women. Anyway, I'm just trying to get a laugh. I don't really mean that.
It's because we look after ourselves, and you men do. You don't look after yourself.
Well, you don't know what I do.
You don't want to talk about andropause and looking after yourself. See? You know.
Quite right.
Sorry.
So basically that change is what is causing people to die younger. Unemployment. Now, just to talk about it, to put this in the context of a worker, let's call him Jimmy. Now, he's a contractor, you can see that. We pass a Jimmy every day as you're going to work and travelling around Glasgow. Now, sometimes they're very well organised and very good sites, and you can tell they've got all the gear on and there's some supervision, there's a controlled workplace. But just as often, and more often, it's an uncontrolled workplace. And they've not got the right gear on, they're using machinery, very noisy machinery, hazardous tasks, they haven't got PPE on. And here Jimmy's a contractor, he's age 50. And you can read what I said there. He's already got, he's got no eye protection, he's already got noise-induced hearing loss, he's already got early stage vibration, hand arm vibration syndrome, things that sort of lines raised in the past. And these are all the other health problems he's got at age 50. Back injury in the past, osteoarthritis of the spine, shoulders, it's increased in heavy manual workers. He's had 6 visits to accident and emergency and has never been recorded as a work accident. A lot of the work accidents that happen are invisible and are not recorded by the HSE. He's had 1 hand fracture, and he's, because he's 50, he's getting a bit past it. I know that doesn't apply to any of you. So we're missing a slide here. What actually happens to him is eventually one day is a serious fracture. Pipe falls in his leg. The last pipe that rolled in a worker, a company that I knew, the worker died. But in this situation, he rolls in his leg and he's got a fracture of his tibia and fibula. Tibia and fibula, that's through the lower leg. And of course, the NHS is very good in that. The ambulance rushes along, gets them into hospital, operated within 1 or 2 days, and out of hospital after 2 or 3 days. They don't ask him about his job, because the health staff are too busy. No one's thinking about return to work. They're thinking about how can we get this person out of hospital because of the waiting lists. And so he goes home. Doesn't get any physiotherapy before he gets out because it takes too long to organise it. He rests at home and he watches TV. If you sit and watch daytime TV for more than 4 weeks, you end up with clinical depression. And everybody else has gone to work, so I don't recommend you try it. He progresses to walking with a stick. He still had no physio. He's got wasting of his quadriceps, that's the most important muscle in the body, the thigh. And it gets reduction in power in both legs. Deconditions. After two months, the GP says, oh God, tell me about this. Let's organise some physiotherapy. So he goes for physiotherapy and you can get it for 6 weeks in the NHS. Once a week for 6 weeks. And pain and weakness, and he's deconditioned. GP says the job will be too much for him. The follow-up hospital appointment, they don't ask him about work. Because the surgeons are too busy with 30 people to see within a couple of hours and are looking at the fracture being treated properly. Is it healed properly? No access to occupational health, just like 45%, 55% of the Scottish workforce, the UK workforce. Basically, to put this in perspective, this is the way we look after athletes and professional football. There'd be no sport any Saturday. You have to remember that. This is exactly the problem. So, is it a lack of rehabilitation? We could do a workshop on this. What's the things that would have sorted out? Lack of rehabilitation, guidance about work, no occupational health and safety advice, etc., etc. And no aspects of care. And probably he's a subcontractor to a contractor to another contractor. So he's living in a very unregulated way. And so he's lucky. He might know the foreman and get a job driving the dump truck. But generally he'll be sacked and go into benefits. And sometimes any work benefits are stopped within a week or a month. It's just statutory benefits. So we've got a lot of people who have I can't read it. Because I'm an aging worker, my vision's getting bad. So these are the main disabling conditions. Looking at Glasgow population, there's a study we did a few years ago, but just showing what the main reasons of doing an incapacity benefit. And someone's mentioned mental health already today, and mental health has been growing. Just a little anecdote if I've got time. In 1985, the biggest cause of people in benefits was back pain. Then it started to reduce, and it was replaced by mental health. The graph does this, mental health went down that. What was the differences? We changed, there were new medical guidelines about how you dealt with back pain. Putting people to bed in a hardboard under the mattress for 2 weeks was found to be completely damaging. It's far better to stay active. So there's something happened there with a decline in people with back pain and a rise of mental health problems. Nature abhors a vacuum. And now the other thing to show you too here and why functional capacity is important here. So Jimmy, this is deprivation, the chart for deprivation. Okay. On the right side of the chart, that is the highest level of deprivation. And that's showing you the death rate per 100,000. Okay. On the left, right at the bottom there, Scott, privileged, unison man. Takes care of himself very well. So he's not going to die as often as the person who's highly deprived. We hope not anyway. So worklessness is the single most important cause of health inequalities, social exclusion, deprivation and mortality. So it's really important we look after workers and help them continue working, because the effect is huge. And we can talk about the failures, why this happens. Lack of occupational health. GPs now get the fit note to sign, but 95% of fit notes, something like a huge percentage of fit notes, say the person's unfit. GPs are not able to really assess what people are doing. They don't know the job. They can assess function, but they don't know what the job is. And NHS doesn't have functional capacity as an outcome measure. So this is what happens to, you can tell by looking at me, which part of this chart I am, and this is what happens with aging. We're all aging, okay? And, well, some people say they're too old to be working. But actually, there's been quite a lot of studies looking at this now, the needs of older workers. And actually, people in their 70s can do a lot. There's a lot of people in their 70s who are able to work and want to work, and that proportion of people is increasing. So we need to be thinking about how do you keep people fit enough to get through the period of with all these new conditions happening. Where do they get the advice to their employer and them about work adaptations or work adjustments? That gets round to occupational health. Now, in that respect, I think you are all potentially, we've got a huge lack of occupational health, and I think you with training would be able to be active in this sphere. And I think that's really important. Just been talking to Nick about that, and I've talked to Scott about that as well. So I think we should try and do that and improve your knowledge of occupational health, how to assess people, what function, change, what can they do, the ergonomics. You know a lot of it already, but I think it's something we should be looking at, because there's no evidence that Scottish Government is doing anything to increase get us towards universal access for occupational health, which I've been calling for the UK for the last 30 years. And in Scotland, and meetings with ministers and things like that, and nothing happens. So as you age, one of the problems is you put on weight. That is not a desirable thing to do. Right? That actually increases your risk of disease. As you age, as you're sitting here just now, you're losing muscle power 1% per annum over the age of 30. 1% per annum, and you're losing muscle mass. And if you look at muscle strength and risk of dying, there's an inverse relationship. So one of the ways we can test frailty in people is grip strength, measuring grip strength. People with a strong grip strength are more likely to live longer than people with a weak grip strength. So that's something you can do to help you all sign up tomorrow for a gym to get fitter and stronger. So that's just a little tip. There's a whole lot of other things as well. Reactions are slower, so you don't want to be a fast jet pilot. If you're getting old, but in fact you can do most jobs nowadays. cognitive, the cognitive change with aging. Well, most workers over the age of 65 have got good cognition. Increase of risk of early dementia starts about over 70. And all the research shows that older workers want to maintain and update their skills and access to training just as workers in general do. And we need to actually be focusing on retraining of older workers, but perhaps in a tool, for example, a tool centre that had all that traditional training, now they've got to use a CNC machine. But also there's huge potential for retraining. Many people have trained 50 years ago, but they need retraining. So just to finish off really, if we're comprehensive occupational health, we should be offering everybody over the age of 50 certainly a health check or MOT and picking up things so that they can adjust the job if necessary. So, the likelihood of returning to work, there's a big study I did, it's my last slide, Scott. This was a big 13,000 people going through the Welfare to Work programme just a few years ago. And in a big study funded by the MRC, we looked at the risk of losing their job. And you can see here that the likelihood of returning to work was inversely related to the number of medical conditions. And part of that we can influence. We know from other research that if you give these people good advice and adjustments in the workplace, you can help them to work longer, and that's to their benefit. And it's not about working longer in nasty and dangerous jobs. It's about appropriate adjustments, retraining, appropriate adjustments. But they need to be getting health assessed. So I'm going to stop there. So that's why functional capacity is important. It's fundamental to the well-being of workers and fundamental to their ability to earn money and feed their families. So thank you very much for your attention. Hope that's been useful.
Thanks very much.